I'd like to come back to the first point you made as well about these 5 factors. The first one was how people approach their own pain. Is it their own culture? I think you might have said. I can't remember what you said now. But...
Yeah, no. Well, it's your patient, your beliefs and characteristics.
Word, yeah.
Okay, so however people get to hear about their beliefs, I've heard people coming in and saying, "I mustn't move. I've slipped a disc, and if I bend, that disc will pop out." And you're wondering, what's going on? What's the picture? What's the picture that person is seeing of that disc slipping out? Or I will hear somebody say, I can't move. I've slipped a disc. It's going to pop out. Am I going to end up in a wheelchair? And you're thinking, wow. Where did you get to all of those? How did you line those dots up?
Where did the knowledge come from?
Where did the knowledge come from? Is it from, an aunt or something who started with back pain and ended up in a wheelchair, or so? We need to get to the bottom of that to understand where that pain idea came from.
I see. So do you often ask that question? What gives you that impression of that's going to happen? Do you often ask that?
That's right. I didn't to begin with, but once I began to sort of study this in a little bit more depth and understand people's fears about their pain, yes, that's something that I try and get to the bottom of, and so that kind of feeds into the work that I've done around pregnancy and pain. So, for example, when I was telling colleagues in our Faculty of Health, back in probably 2011, when I was talking about my PhD and how I'd done work around pain, I remember one of our professors of nursing saying to us, "Oh, well, don't talk to the midwives about pain, because they don't believe that pain is important." Anyway, at some stage I got chatting to Professor Venora Hundley, who is a professor in midwifery, and we started to put together some projects, and we had our first PhD student looking at pain management in labour. So Professor Venora Hundley is her research is around early labour pain.
Okay.
And she specifically has been doing a lot of work around
is this like the what do they call it, Braxton
Hicks? Braxton Hicks are a sort of the uterus sort of contracting, and some people get Braxton Hicks towards the end of their pregnancy, as a practice, or that's what you hear about, isn't it? That it's that the muscles are practicing contracting.
Oh, I see. Ready for the big event.
Ready for the big event. Some people don't seem to get Braxton Hicks. It's not until they begin to go into labour that they get that. But that's that sort of, So early labour is the sort of contractions that the uterus is getting ready for the delivery, and the cervix is beginning to dilate. So early labour is before the dilatation of about 4 to 5 centimetres, depending on whether you look at the UK recommendations or the WHO recommendations or the US recommendations, because they all have slightly different.
Oh, really? I had no idea.
No, that's right. I've learnt this along the way. It's not necessarily something a physiotherapist necessarily learns, but the midwives have taught me. So the aim was to try and help women manage their pain in early labour, and looking at how the sorts of things that we use to manage musculoskeletal pain. So one of the things was keeping women moving during that early labour, and so we did a randomised controlled trial on the Isle of Wight, looking at using a birth ball to keep people upright and moving, because again, if you stay upright, then you're more the gravity helps you with birthing, and if
you don't need to be fighting against another.
That's
thing.
right.
Gravity on top of everything else you go through.
Well, that's right. So, which is what happened when people were then put into a birthing room and laid flat on their back. You've no longer got gravity working to help you to give birth. That's why it's quite nice to be upright and in a pool.
Yes.
But we've also upright and on bean bags, or upright and on on a
ball.
Yeah. Physios call it the Swiss ball. I imagine the Swiss must have invented it or something, and midwives call it a birthing ball.
Okay.
But we had a trial looking at that. The aim is to if women come into hospital too early, they're more likely to have an intervention. That means a cesarean or an epidural or any of the other interventions.
That's really interesting, because I remember from our experience of our first, I think so, more than our second, we called them fairly early on, and they kept saying, give it a bit longer, yeah. So that's obviously the reason.
That's right.
I see. Because we were wondering, right. Why can't we just come in now? Like, my wife was, come on, I need to.
Yeah, that's right. And so what we're trying to do is, and at the moment, so within that has built into a second study, and now we're trying to sort of, use that work to try and inform women about what they can do to support themselves. So one of the commonest reasons women come into a birthing centre in early labour is because they can no longer manage the pain. And what we have found in our research is that some women will, what we call, are more likely have beliefs and characteristics that mean that pain they associate with a lot of damage, or they associate negatively, and that
more so than men would. You mean? It's hard to say, surely, with the pregnancy thing.
Oh, yes,
You
yeah.
just mean...
I don't think this isn't sort of necessarily a comparison between male and females, because males will also we term it catastrophize about their pain. Sometimes I think that's not it's not a great term. It's the way in which we measure it or talk about it.
Yeah, I think it's a fairly
but it's a feeling
term.
It's a feeling of that pain may be causing more damage, more injury, and men will feel it as well. Obviously this work has been around women, and women. We've looked at university students both here and in Nepal, and looked at the sort of prevalence of pain, catastrophizing.
Right.
So it's there early on in life. But yes, so following any surgery, some people will ask for more pain relief, probably because they are catastrophizing about their pain. So it's about their pain beliefs.
Mm-hmm.
So if you're going to reduce that catastrophizing around pain, maybe you need to put something in place preoperatively to say you will feel pain afterwards.
Manage the expectations.
Help manage the expectations.